Hello, Dr. Byron Bucky Phillips, MBA, your tennis pro, your executive coach, your life coach, and your professor. The topic for the video is the leader and cortisol levels. There is a relationship between leadership and levels of cortisol in our bodies. Leaders have lower levels of cortisol than non-leaders. The higher the rank of the leader, the lower the level of cortisol, at least on the aggregate. Greater sense of control is often attributed to lower levels of cortisol. When managers experience acute stress, the release of cortisol helps them deal with crises and even relieve some temporary anxiety. Leaders are more likely to lead if they have high testosterone levels and lower cortisol areas for the most part. Higher cortisol levels can hinder collaboration, however, and innovation because people will feel unsafe many times with too high of cortisol levels. Simon Sinek, in the book Leaders Eat Last, noted that cortisol can inhibit oxytocin, which, as we know, is a chemical responsible for empathy and compassion. The constant flow of cortisol is a horrible thing for our personal and professional lives if it happens too often. Cortisol increases blood pressure and inflammation. It can even lead to an earlier death. On a less vital level, it's going to affect stress levels and your cognitive and creative abilities. So cortisol will increase aggression with many people and can elevate stress to dangerous levels for the individual and for others. Cortisol will compromise our immune system, which has short, medium, and long-term effects on health. So the leader can learn to provide the open organizational climate so that people thrive as they advance the goals of the organization. Be aware of those stress hormones